positively, living positive, living positively, living positive.
Molweni namkelekile kuSiyayinqoba beat it inkqubo yakhe wonke ubani ophila kanye nochaphazelekayo intsholongwane kagawulayo. Igama lam ndingunokubonga Yawa yaye ndiphila nentsholongwane kagawulayo. Isifo somhlaza okanye i-TB inganyangeka ukuba isiguli sithatha amayeza ngendlela eyiyo. Kodwa eMzantsi Afrika kule minyaka mithathu idlulileyo kuvele iintlobo ze-TB ezingeva amayeza. I-multiple drug resistance TB eyaziwa njenge-MDR TB ayinyangeki ngamanye amayeza esinawo ukunyanga i-TB. I-extremely drug resistance TB okanye i-XDR TB yona iyingxaki enkulu. Ngoku masikhe sindwendwele i-Medical Research Council eDurban apho ososayensi bavavanya iyeza elitsha elinokunyanga i-MDR TB.
Namhlanje silapha e-Medical Research Council sizothola kabanzi ngocwaningo olusha olwenziwayo ngemithi yokulapha i-MDR TB emisha. Ake siye ngaphakathi. Njengamanje la e-MRC kukhona ucwaningo enilenzayo. Bengicela ungichazela ngalo lo cwaningo ukuthi luyini.
Sizama ukuthola ipilisi ezakwazi ukuthi lisebenze kahle liphinde linciphise nesikhathi sokulapha i-MDR TB.
Sisile pilisi elisha lizokwenza kanjani ukuthi ukutreata ama-patients ane-MDR TB kube ngconywana kanti futhi kube lula?
Okubalekele ngelipilisi ukuthi kwimiphumela esele iveziwe kolucwaningo ukuthi lona liyakwazi ukuthi lolaphe i-MDR TB ngesikhashana nje esincane. Uma sijonga kwimiphumela ngoko esandula ukuphuma yokuthi ama-patient within 2 months abesele kwazile ukuthi izikhohlela zawo zibe azisabonakalisi TB.
Silapha eKing George Hospital sihamba noSisinonqubela sizothola kabanzi ngolwazi lolu locwaningo lomuthi omusha we-MDR TB. Ake size ngaphakathi isibhedlela siyibonele ngawethu.
La ngamapilisi ocwaningo lapho i-patient ithi uma get day of enrollment i-patient iyawathatha amapilisi amasonto amabili lapho iwaphuza daily and then kuthi emveni kwamasonto amabili i-patient iwaphuze kathathu ngesonto funeka kube nosuku ngaphakathi.
Siyancipha isikhathi sokwathatha amapilisi ngokuya.
Risposta completa. Ngaphakathi kwinhlozo into ogulayo zamula phezulu seTB.
Inhloboni ye-TB ekuphethe njengamanje?
MDR.
Bengicela ukwazi ukuthi mhlasimbe usube naye MDR isikhathi esingakanani?
Engikwazi emva kwenyanga nje angaqethi nenyanga ngazi nje nge-MDR.
Mhlasimbe uyazi ukuthi uzothatha isikhathi esingakanani la esibhedlela ukuthi ize ilapheke njengoba uthatha i-treatment?
Engizoba sesibhedlela for 6 months. After the Siyayinqoba needed treatment for 2 years.
In the last 5 or 6 years, suddenly people have realized the true significance of the TB pandemic, particularly in association with HIV. And the trial that we're involved in is the first trial of a new TB drug for 30 years, which really shows potentially big benefit for patients either with TB or MDR, multi-drug resistant TB.
Could you please tell us in detail what the processes are for the trial?
Patients get their standard MDR, multi-drug resistant treatment, which is 5 or 6 drugs for 2 years. And then half the patients get the real drug, TMC-207, and the other half get a tablet or a placebo, which looks like the real drug, but isn't. The patients are then followed up in exactly the same way. Their treatment outcome and success is measured in exactly the same way, and they're monitored very carefully to see if there's any difference in the safety.
Is there any side effects? Is it better than the drug that is currently available?
That's a very good question, because when you start off with a completely new drug, you don't know what its side effects are. You can't predict it. So one of the key things in clinical trials is to find out whether a drug has side effects or not. So already the MDR drugs that patients take have a lot of side effects. It was anxiety at the beginning that TMC 207 might add to those. The only side effect that's so far come up is maybe the drug is associated with a little bit more nausea when patients first start taking it. So we're very excited and encouraged that this drug seems to be safe, although the number of patients who've taken it is still small, so we'll have to wait until more people have taken it before we're absolutely certain that there's no unforeseen toxicities.
Considering that the drug is much better seemingly than the previous one and it has less side effects, do you think that it will be more costly than the one that you have now?
It will be up to the manufacturer of the drug who'll be making the drug available. However, it's anticipated that, like with ARVs, in countries like South Africa, where there's a great need for such new treatments, that special arrangements will be made so that patients actually can get access to them.
Namhlanje ngifunda ukuthi sekuphele iminyaka eyama-30 kungakaze kube khona umuthi wokulapha i-MDR. Kodwa manje kubukeka sengazathi seyikhona indlela yokulapha i-MDR TB ngendlela ezosebenza.
Kungangcono kakhulu ukuba eliyeza singalifumana khona ukuze sikwazi ukunyanga i-MDR TB. Ukanti ngoku masike siye ngaphakathi siyothetha no-Dr. wethu Dr. Majoro simve xa sichazela kabanzi ngalomba. Masiye phakathi simve uba uzawuthini. Dr. Trevor, eliyeza litsha i-TMC 207 lise kuvavanyo okwangoku. Xa ucinga uba ngabana liyaphumelela koluvavanyo lukulo lingathatha ixesha elingakanani uze libe available kwizibhedlele nakwi-clinics zika-government?
Once kuprova ukuthi le drug entsha etreata i-TB resistant, uma ngabe isebenza kumele ibe available as soon as possible, ngoba siyazi manje ukuthi abantu abaningi abane-TB futhi aba-infected nge-HIV yibona abasoleka ngobuningi, especially laba bane-resistance. So the sooner iba available the better, the quicker iba distributed the better, the quicker iba affordable kuwo wonke umuntu. Yiyona into esifunayo leyo.
Doc, njengokuba uyazi bana ngoku ukunyanga we-MDR thatha ixesha elide kakhulu. Xa ucinga ngale drug intsha ke ngona ke noba imiphumela izawuthini okanye yona izawuthatha ixesha elingakanani ukuyinyanga i-TB?
Enye izinto esizibhekile ngeso elibukhali ne-hope ukuthi le drug yona i-advantage yayo izokhona ukuthi i-treat i-TB resistant to i-treatment ngesikhathi esifishane. Sizotreat abantu within a short space of time, and so the number of people abazobe treated, the number will go high because logo khona manje kuthatha isikhathi eside, as you rightly said.
Siyabulela ngokuba nibukele uSiyayinqoba Beat It. Siyathanda ukufumana imbalelwano zenu, inkcukacha zethu zivelile kumabonakude wakho. Ungaphoswa zezi condoms izintsha zibhalwe uSiyayinqoba Beat It. Protect yourself, protect others. Bye.